Our next presenter would be Dr. Abhishek Kumar Sinha.
Okay, good afternoon everyone. So my topic for today's presentation is autologous serum eye drops versus lubricating eye drop for the treatment of dry eye disease. So as Deuce 2 defines dry eye is a multifactorial disease of the ocular surface characterized by loss of homeostasis of tear film accompanied by ocular symptoms in which tear film instability, hyperosmolarity, ocular surface inflammation, damage along with neurosensory abnormalities, they play etiological roles. The symptoms include but not limited to are scratchy feeling in the eye, tingling or burning sensation, red eyes, photophobia and blurry vision. So, study design is a prospective, randomized, comparative, and open label trial conducted by enrolling patients visiting OPD of the Department of Ophthalmology. Patients diagnosed having dry eye due to any cause and satisfy the inclusion criteria were enrolled in the study after getting the informed consents. The study procedures followed the Declaration of Helsinki and was approved by the Institutional Ethics Committee. The trial was conducted over a period of 4 months after due approval from DEC. 378 patients who visited OPD with typical complaints of dry eye due to any cause were given the option of centrifuging a small quantity 10 ml of autologous blood and use of eye drops prepared from its serum or go with the conventional eye drops. So Schirmer 1 test score and TB-UT were used as efficacy parameters and safety was monitored on all visits. Subjective improvement in symptoms were duly noted. Chi-square was used to find the association between the categorical variables and p-value of less than 0.05 was considered statistically significant. So inclusion criteria: participants of both genders aged 18 and above presenting with symptoms of dry eye. Exclusion criteria had any known person with hypersensitivity to the study medications and those who had any other topical ophthalmic medications within 14 days other than tear substitutes or were prescribed any other topical ophthalmic solution other than tear substitutes were excluded from the study. Clinical workup included a detailed history and ophthalmic examination, and those satisfying the inclusion criteria were enrolled in the study after obtaining an informed consent. Participants were divided into two groups: a group A for autologous serum eye drops, and group B received CMC or sodium hyaluronate tear eye drop substitute for 90 days. So the method for serum preparation was collect the whole blood in microcentrifuge tube. After collection of the whole blood, allow the blood to clot, and by leaving it undisturbed at room temperature, it usually takes 15 to 30 minutes. And then we go to the pathology department, remove the clot by centrifuging it at 1000 to 2000 rpm for 10 minutes in a refrigerated centrifuge, and the resultant supernatant is designated serum. So following centrifugation, transfer of the liquid serum into a clean centrifuge tube using a pipette, and the chamber should be maintained at 2 to 8 degrees centigrade while handling, and serum is then stored in a sterile empty bottles labeled and given to the patient. This is how we prepared the serum eye drops. We labeled the name, we age, and labeled the serum, and then we gave it to the patients in empty bottles. So the efficacy parameters were assessed on day 15, day 30, and day 90. In addition to your substitutes use, we advise participants to blink voluntarily more often, and ocular surface disease index was administered to the patients on all visit. It is a questionnaire which included the TFN breakup time, Schirmer test, and adverse drug reaction monitoring. So this is the age distribution. We had the age from more than 18 years. We included everyone, but those, of course, those who satisfied the inclusion criteria, but less than 18 years we could not include. uh, this is the gender distribution of the study participants. This is the comparison between the OST between two groups at follow-up visits. This is group A. Group A is the which we used the serum eye drops, and group B is the one which we used this sodium hyaluronate or CMC. So 87 patients whose autologous serum eye drops were group A, whereas group B were CMC or sodium hyaluronate eye drops. So clinically, autologous plasma was almost equally efficacious to the other tear substitutes with slightly more improvement seen in TOBT. There was significant symptomatic improvement in both groups, and both groups were satisfied with their treatment. Both CMC and sodium hyaluronate tear substitutes were equally efficacious, and all three were safe in reducing the symptoms of dry eyes. So, in discussion, the results of the study show that tear substitutes are equally are efficacious in reducing the dryness of eyes, as well as it is evident from the reduction of OST scores. The OST score reduced with the treatment in both groups on all follow-up visit. This showed that both tear substitutes were efficacious in reducing the symptoms of dry eye. The results are similar to other studies where improvement in OST scores has been shown with the use of both serum and CMC or sodium hyaluronate eye drops. Both substitutes are efficacious in reducing symptoms as they moisturize the ocular surface, and having a high viscosity increases the retention time, and hence they are beneficial to the patient. Being a part of one's own body, the autologous serum eye drops may have some additional properties which could have been responsible for better improvement in TBOT when compared to CMC or sodium hyaluronate. So limitations of the study are the inability of the patient to adhere to the therapy, use of an open label study design, and inability to include osmolarity. Study fails to establish any clinical significant difference, and the study aids in open windows to large scale double blinded studies that may be required in long term to validate it. So these are the references.
At one point you mentioned that along with serum you have given substitutes also. Is it so?
No, sir. We had two groups in which group A we administered autologous serum eye drops.
Serum only.
Only.
Nothing
And the other group was given other tier substitutes such as CMC, sodium hyaluronate mostly, and some were also given.
I misunderstood.